Hi, good afternoon. I hope everyone enjoyed the last session as much as I did. My name is Perry Barrist. I'm a part of March, and I am so happy to introduce our fifth panel today, titled Disrupting the System, Addressing the Broken Medical Structure Impacting Black Birthing People, moderated by Dr. Monica R. McElmore. Dr. McElmore is a tenured Child, Family, and Population Health Department professor and the interim director for the Center for Anti-Racism in Nursing at the University of Washington School of Nursing. Prior to her arrival at the University of Washington, she was a tenured associate professor at the University of California, San Francisco, and was named the Thelma Shobe Endowed Chair in 2021. She retired from clinical practice as a public health and staff nurse after a 28-year clinical nursing career in 2019. However, she continues to provide COVID-19 and flu vaccines. Dr. McElmore's program of research is focused on understanding reproductive health and justice. To date, she has 94 peer-reviewed articles, op-eds, and commentaries. Her work has also appeared in publications such as Dame Magazine, Politico, ProPublica, NPR, and she made a voice appearance in Terrence Nance's HBO series, Random Acts of Flyness. She is the recipient of numerous awards and currently serves as chair for the Sexual and Reproductive Health section of the American Public Health Association. She was inducted as a fellow of the American Academy of Nursing in 2019 and became the editor-in-chief of Health Equity Journal in 2022. Welcome to the stage, moderator Dr. Monica McElmore.
We doing an Oprah thing? Wow. Hi, everybody. It's so good to see y'all. Oh, my goodness. I'm so excited to be here. So a couple of things. Hi to all the digital folks. I've been watching you live tweeting and doing Instagram. I'm very grateful to be here. You know, my sister from another Mr., Dr. Ndidi, you know, we the Trenton people represent. And so thank you so much for building infrastructure and talking to me on Thanksgiving of last year so I can make sure that this could be on my calendar so I could actually come. Because I have watched virtually this conference, I know at least for the last 2 years, because I've been double or triple booked. So the idea that I could actually be here, especially on a panel called Disruptors with the people that I'm going to get a chance to talk to, I'm super excited. So I know all of them personally. I am going to read the bio, but I'm going to embellish because I know all of them. So our first panelist is Dr. Nakia Grayson, and I'm really glad she took me off punishment last night because, you know, it's all love. She's a reproductive justice informed public health activist, anthropologist, and family nurse midwife who has devoted her life to serving and empowering people in underserved communities. And Dr. Grayson is the chief clinical officer at Choices Center for Reproductive Health. And if you've never been there, oh my goodness, it's just one of the most incredible places in the world, and they have built such incredible infrastructure there. I highly recommend it, but don't overwhelm them because, you know, they'd be busy. Where they opened the first nonprofit comprehensive reproductive health center in the country, the first birth center in Memphis, and it is the first site for the Black Midwifery Fellowship. So, Dr. Grayson, come on down. I'm a big fan, big fan. The second panelist I'd like to invite to come on down, y'all know her, y'all love her. You've already seen her today, is my other sister from another Mr., Dr. Michelle Drew. Dr. Drew is a certified nurse midwife, a family nurse practitioner, and the founder and executive director of Ubuntu Black Family Health Collective, which we heard about this morning, which is a community-based organization that serves as a social safety net in Wilmington, Delaware. She is a first-generation college graduate, but a 10th-generation midwife with a documented ancestry of midwives back to her 7th great-grandmother, Sarah, a free Black woman in Surrey County, Virginia. For those of you following me on social media, you also know she's my roommate and one of my closest confidants anywhere I travel. So thank you for coming down, Dr. Drew. Our third panelist is Mama Jeannie Joseph. Let's give it up for Mama Jeannie Joseph. Time Woman of the Year. Time Woman of the Year. Let's go. Jeannie, exactly, right? British trained midwife who fights to ensure every person has their healthiest possible pregnancy, birth, and postpartum experience with dignity and support. Mama Jeannie, I can't call her by her first name, out of respect. Mama Jeannie created the JJ Way, which is an evidence-based maternity care model delivering readily accessible, patient-centered, culturally congruent care to women in areas that she terms maternal toxic zones, and she's been holding it down in Florida. Love you. And then we're going to welcome back to the stage someone who I tapped to be part of my advisory committee for the newly renamed Manning Price Spratlin Center for Anti-Racism and Equity, or what we call CARE in Nursing Center at the University of Washington. And if you don't know Frankie Manning and Lois Spratlin, you need to know who those two black nurses were, and because we stand on their shoulders. Anyway, Dr. Lucinda Canty. Let's give it up for Dr. Canty again, our opening keynote speaker. Is a certified nurse midwife and an associate professor of nursing and the director of the Seeds Work Health Equity in Nursing program at the University of Massachusetts at Amherst. And she received her BSN from Columbia University, her MSN from Yale University, specializing in nurse midwifery, and her PhD from the University of Connecticut. Her research interests include the prevention of maternal mortality and severe maternal morbidity, reducing racial and ethnic health disparities and reproductive health, promoting diversity in nursing, and eliminating racism in nursing and midwifery. I also know her incredible work with the National Commission to address racism in nursing with the American Nurses Association. So let's give it up for the excellence in black midwifery. So when I say things like, I'm midwife adjacent, that's what I mean, because people know I'm not trained in midwifery, but I hang out with these four often. So that's it. This panel is called Disrupting the System, Addressing the Broken Medical Structure Impacting Black Birthing People. And it was purposefully and effectively and affectionately entitled this because each of you have taken it upon yourselves to disrupt the status quo and to really challenge our clinical systems. So I want you all to think about this. I'm going to start with Dr. Grayson, though. Exactly. What personally motivated, your level of activism? And if you can, how do you manage to train and practice in institutions that have, cultures of racism and anti-Blackness?
Yeah, okay, so what... I can't even look at Monica. What led me to this, right? Okay, so first of all, I think that I grew up in a space where we were taught to speak up for people, right, and to care for the least of these. Then I went to Howard University, and I think that we teach Protest 101 and orientation, right? If you ever been to chapel, they all come through there. Hey, we're meeting at such and such a protest, X, Y, and Z. I mean, that was every Sunday. So, I think that fire was always there. But I think that what led me to the work, I know that what led me to the work was when I was doing some work as an anthropologist. I'm an applied anthropologist as well, and was working on a project evaluating the March of Dimes. One of their programs, and interviewing families, and these families talked about infant loss that they had experienced, and it was generational, and they could not understand what had happened. And so it really led me down a path to really trying to figure out what happened. And a lot of them talked about their bodies being broken or feeling like they were not cared for properly by the medical system, or that they weren't listened to. And then I started interviewing older Black women in the community, and they talked about these midwives that they were cared for by. And I was like, where are the midwives? There were none in our community. And so as I started to do more research, especially around Black midwifery, I felt called to reclaim that space for us and to see not only a reclamation, but a restoration of us in our community. And so I decided to answer the call, as they say, and step into that space and become a midwife. And, we were talking about this, Carrie Stewart and I were talking about this earlier, how we kind of came into this as a second, because this was like a second or maybe even a third career for me. And how our younger kids are not really coming into this because they don't know that this is an option. So it was really important to me to open the door and to really hit the ground running so that they did know it was an option, and just bring as many of them with me as I could. So, yeah.
Appreciate you. Dr. Drew, what has motivated this level of activism? And, what's personally motivated this level of activism?
Personally, well, I mean, I came by it honest. I am Mabel Drew's daughter, Viola P. Henry's granddaughter, and they never saw an issue they wouldn't take on. I used to love when teachers would be like, "Miss Drew, do I need to call your mother?" "Oh, yes, please." Because when the woman who's like 6 feet before her afro showed up in a black turtleneck and jeans and black leather boots, and there were a bunch of, my motorcycle riding Black Panthers in the parking lot, it was like, this was not going to end how you thought it was. And you say something, and the question talks about, a system that's broken. But the system isn't broken. The system is working exactly how it was intended. Yes. And so, I decided early to, not try to fit in, because there's no way. I am loud. I am Black. I am unapologetic in believing that this country was built on the backs of Black folks, on land that was fed by indigenous people's blood. We don't owe anybody an apology. So I will earn your respect or not if you choose not to give it, but what I'm not going to do is back down in any fight, and especially in a fight that's killing our community and destroying not just our health, but our culture, and doing it at a big profit.
Thank you for that, Mama Jenny.
Yeah, I think my story is so inextricably tied into physically, geographically being here. I was called to midwifery since I was a little young kid. At 16, I knew I was going to be a midwife and not a nurse. At 19, I got into midwifery training in a hospital-based environment and became a midwife at 21. And I have been in midwifery my entire adult life. But I've spent 32 years of midwifery in the United States. And from the day I got off the plane, because I didn't do not a scrap of research, just like, oh my gosh, I'm going to America. I'm going to marry this gorgeous Black man and it's all going to be lovely. So that will teach me, right? Because when I got here, the first thing I found out was, well, what are you talking about, midwife? We don't even know what no, we don't do that. That's old, and that's not the way. So it took me a minute to readjust to that, but I started working with an OB because it was a Canadian OB, a white Canadian man who knew what a midwife could do, put me in his office and said, you can't go to the hospital, but stay in this back office here and you can work with me. Within a year, and I came with endometriosis. I had had it my whole adult life, and I'd had lots of treatments and lots of problems, but within a year, I lost my uterus and both ovaries. I was 30 years old. Because I had no clue. That's why. And that opened up for me what I now understand full well, and I'm just sick even to this day. 1989 to today, I am furious that this is going on in plain sight. And like Michelle said, it is on purpose, and it will prevail. Because what we're talking about is justice. This is not about medicine. This is about power. And this is what has me so worn out and overwhelmed, and yet can't stop, because we must fight. And that's how I got to do what I'm doing. And you see all these wonderfully, beautifully credentialed folk right here. I don't have a piece of paper. I am a midwife. I'm not a nurse. I'm not an academician. I have not been to college. I have just done that one thing. And that has led me to this space right now, to be able to sit here and talk with you all. And the disruption that I'm up to is no more. Every person, every time, as a human right, deserves to have respect, dignity, and autonomy, just because.
Yes, let's do this. Dr. Cancy.
And I think that I have that same anger. And for a long time, I was silent because I used to believe anything that people told me. Even when I felt it wasn't quite right, I believed it. And when I started talking with Black women, learning their experiences, learning the trauma that they experienced, I was like, I'm not going to be silent anymore. And then it was George Floyd on top of that, in plain sight, and people still arguing whether or not this was right or wrong. I'm like, this is ridiculous. And so I just felt like it was just boiling up. And then I had to fight out of my doctoral program because it was like, and this is really what set me off. There was something in my study that all the Black women said. And I told my advisor, and she's like, oh, you can't say that until you talk to white women first. I blew up. And I started fighting, and I haven't looked back ever since. And thankfully I did that because she hurried up and got me out, got me out of the program. But I just realized that when I'm quiet, people think I'm complacent, and they keep on with the behavior. It's like you bring it up. This happened to a patient. This happened to a Black student. And then it's like, okay, we're sorry. And the next week we're back again. So I was like, I'm not going to keep coming back every week. So I'm going to tell them how I feel. I'm going to have the evidence to back it up. And I'm going to let you know I'm going to keep coming back until you stop. Because it's like enough is enough. So that was my point, that now I just like to start trouble. No, I'm only kidding.
Good, because so do I.
Good trouble.
Good, because so do I. I was wondering when we was going to wake up, because, you know, we after lunch, we need some snaps. I'm hoping people, like, on social media, I didn't really say that. You have our consent to be able to clearly be able to, like, make sure you're tweeting at IG. I also didn't ask pronouns, so apologies for that. I use she, her, they, and them. So when we go around again, please tell us so that we can appropriately refer to you. Sorry about that. So the second question, which I know the answer to, so I'm going to answer the first part, but I'm going to ask y'all what y'all think about it, because it's about data and it's about publicly available data and metrics. But then I want you to think about the second part, because this is where I think the brilliance of midwifery is really going to help us. So the question is there, and it should be, are there publicly available metric to measure which hospitals have higher rates of Black maternal mortality? And if so, if not, what would be the best way to measure and hold institutions accountable? Talk about disruption. So depending on how you measure this, right, in terms of, are there metrics to know which hospitals are performing well or performing poorly? You know, I was really glad to hear Sister from Another Mister, Dr. Ndidi, say that next year's we're going to be about information and data, because, you know, the best data that we have about this comes from our good colleague, Kimberly Seals-Allers, and the Earth App, where we're really looking at patient-driven metrics and data to tell us which hospitals, which health systems have, you know, places to be avoided. It's almost like the green book for hospitals and healthcare, right? Mm-hmm. If you want to keep your comments very high, at a high level, to talk about, you know, which institutions, you can do that, or you can name names, right? Because I think at some point we need to really start naming names, like my previous employer, who allowed me to be the only Black tenured professor at the associate level out of 3,516 faculty in a blue state like California. I said it. Writing about it too. But seriously, if we don't know that those data exist, right, how can we measure it, and how can we start to hold institutions accountable from a midwifery perspective? Because people are always talking about y'all are the solution, but then we never ask you, how should we be thinking about this?
Can I jump in?
Please.
I want to just talk a little bit about how to be able to get to answer those questions. We support the community-based orgs and providers, helping them build the infrastructure to be able to gather and own their own data, so that we can then have something that is, you know, there's fidelity in that data. We still are at the mercy of those data collectors, even with our own data. And that's a problem.
Yeah. I mean, it's one of the reasons we worked really, really hard with Dr. Karen Scott to really make sure that there were good inpatient QI and hospital-based data of people's experiences, right? But I do think that there is a way for us to think about midwifery. Oh, and one thing we didn't say is we are, intellectually and credentialed agnostic, because, or let me use I statements, because I work with midwives regardless of what your educational preparation is. So I appreciate you naming that, Mama Jen. That for me, it doesn't matter what your credentials are. Midwives, we have a way to move forward in the future. And one of the ways that we need to do that is to think about, what would y'all measure differently than being beholden to researchers like me and other folks, that, maybe we should be ceding some of that power you talked about.
And money. Right?
And access.
Because once again,
Yeah.
so just real quick, and then I know you have a comment, but I want to say the other thing is the undercounting of the data that's actually useful. Like morbidity is a big stinking deal.
Yeah.
And 50,000, maybe 100,000. I would say it's probably 2 million women and people are suffering morbidity that we aren't even accounting for.
Yeah, agree.
Every 4 million births a year, 50,000, yeah.
Yeah.
It's like, yes, but no, and. So interestingly enough, every state in the union has the ability to give you this data if they want to, because, there's the Office of Vital Statistic. Every birth that happens in your state gets reported. Who attended it? Was it planned? Was it a home birth? Was it a birth center birth? Was it a hospital birth? We report complications. We obviously have to report mortality. But often what happens is when we tried to pass a bill that would require a report to be publicly available, who was there to
The
block it?
hospitals.
A state, local, AHA, the American Hospital Association, fought tooth and nail. And then the other people that did it was actually the medical, the state medical society and the state ACOG affiliate. Gee, I wonder why. And even when I tried, let's do a study, let's look at a certain issue at the institution where I had privileges and submitted it to the IRB. The IRB sent my proposal to the chair of the department who wasn't sitting on the IRB committee, because it wasn't a good idea. Like, why did I want them to look at morbidity and mortality? And for me, it was one specific measure, hemorrhage. And then I wanted them to qualify it by race. What do you need to know this data for? It's like, I'm a researcher. That's what I do. And so, hospitals are very invested in us not knowing what we already know. And they will fight you tooth and nail to get that information. And one organization that I really think should be interested in it would be the insurance lobby, because if you can track and prove things, if they have data, then they can actually impact their fee schedule and reimbursements. And so they don't want that information known.
Absolutely. I mean, I agree with all that. I mean, one of the things with us at our clinic is that we collect a lot of data, and we are telling our own story at this point and writing about the data that we have on our patients. We saw over 5,000 patients last year. So what's interesting is, though, we asked the state of Tennessee, because I'm in Tennessee, and you all know it's a whole lot going on there right now. We asked the state of Tennessee for the local data to Shelby County. They are charging us for that data. We have to spend almost $80,000 to get the data for the state, for the whole state. So we're now picking and choosing like zip codes so that we can find the money to buy that data so that we can compare it to our outcomes, which have been stellar. But yeah, they don't want you to know this information, right? The hospitals don't want you to know this information. The physicians don't want you to know this information. And you're right, Michelle, if these insurance companies stepped in, then I think that it would be definitely a different ball game. But as you mentioned earlier, Dr. Karen Scott does have an OB-Prim that she has worked on, that we worked on with her, several of us, and the data from that is, really clear. It's really clear what's happening with our patients in these hospitals, but we cannot get these hospitals on board to be supportive.
Yeah, and I think that's going to require a public effort. I mean, because I keep making the argument that state data, taxpayers, all of us, have already paid for those data to be collected.
That's right.
So there's that.
Yeah.
So vote.
Yeah, it's like they're gatekeepers to the data. And they know that it'll uncover something they don't want to be exposed. And that's, I mean, induction rates, cesarean rates, negligence. Those are things that they can sweep under the carpet, and they control it, and they'll publish that. They'll publish, like they'll say, oh, black women, they're not getting prenatal care on time. And then I look at the data, and it's like 2% are not starting prenatal care, you know, or in the third trimester. So I'm like, so the other 99% are. So it's like how they spin it. But my thing is, you know, you're going after midwives. You're going after birth centers. You're going after what people do with their uterus. Put that energy into regulating hospitals and making sure they keep black women safe.
Yeah. Totally agree. So this is a dreaming positive question, because, you know, we need these. What piece of reproductive health legislation would you like to see proposed in 2023? I'm going to start. Because, you know, in the context of Dobbs, right, in the fall of Roe, Congress could pass the Women's Health Reproductive Health Act and fix all of this.
Yes, absolutely.
A lot of people don't know that. Congress could fix the loss of Roe, and now we're in the Dobbs universe. They could fix this if they really wanted to.
Absolutely. I mean, living in Tennessee, yeah, like I said, we have a whole lot going on. So, I don't know. I mean, I think that especially where we are in this very red state, a blue city in a very red state, we're being attacked on all sides. We're seeing attacks on our LGBTQ communities. We just recently lost the ability to continue to care for our trans youth. We've lost abortion access with no exceptions. We just recently had two of our representatives expelled for protesting against gun violence after the shooting in Nashville and standing with the children who want gun control. And we just had a bill passed that will allow teachers to carry guns. So where do I start? I mean, there's so many, and all of those impact reproductive health and reproductive justice. So all of those things are important to me and important to my community, important to the patients that I care for, important to the staff at Choices. And we find ourselves advocating for all of those people who are losing their rights. I mean, we're losing all of our basic human rights. And so if I had a wish, I don't know that I could pick just one. Mm-hmm. You know, like I said, I see people hurting. I have to now talk to families of teens who I've been caring for, offering gender affirming hormone therapy. I have to talk to them about making a new plan and sending them to another state to get care. I have to talk to, I care for pregnant people who want to be pregnant and who don't want to be pregnant. And those who don't want to be pregnant, I have to send them to another state to get care. And then I have to also worry about my children going to school and being shot. So, you know, all of those things are important, all of those things. And then we have the momnibus. And where are we with that?
Say it. Just say it. Because, you know, we have a lot of, and I got to talk about this. I just need a minute to talk about this. We have a lot of people who are signing on to different letters of support of different organizations. You mentioned March of Dimes, CHIP, all these people trying to push through Title V legislation, but the momnibus still is not the law of the land, and that's a problem. Mm-hmm. And so at some point, we are going to have to boycott the primarily led white organizations who want us to sign on for all the different sort of Title V and HRSA and other kinds of, you know, funding to move forward. We're going to have to stop doing that until we can actually get comprehensive legislation like the momnibus.
Absolutely. And hey, Ayanna, you hear Congressman Presley, you know, holla at your sister. She follows me on Twitter, so I know she's listening. First, what's most important, again, same as your answer, Dr. McLemore, but also I'm unapologetic in saying that the Hyde Amendment needs to be overturned once and for all.
Yes.
Because if you're going to finance the system, and let's be clear, Medicaid, and the Center for Medicare and Medicaid is the largest payer for reproductive health services in the country. I have a client right now who has an anomaly, and because the doctor who originally was supposed to do her termination wasn't on call, and his partner was not willing to do it, she missed the arbitrary deadline by which she could have her termination paid for by Medicaid. And so now, because she can't afford to go to Philadelphia or some other state, pay out of pocket, and the abortion funds aren't available, she now has to gestate, as long as she's going to gestate, a child that has absolutely no hope for a meaningful life, all while impacting her health. I mean, we should not have laws that say that, we can enslave you for 246 years, spend another, 150 years, using Jim Crow and new Jim Crow, keep you living in poverty so that you fall into an income where then as a state we get to, determine your reproductive health. And we're going to tell you whether or not you can get pregnant and if you can continue a pregnancy. And also Medicaid should pay for REI. Because you know what? Medicaid doesn't pay for infertility in any state that I know of, and the reason they don't cover it is because if you have the audacity to be poor and be a burden on the state, you don't have a right to create another human being.
Well, I'm just thinking about the fact that healthcare is a human right. I mean, all of the policies, wherever they start and wherever they end, I've had a real, I guess, again, personal, but also, this problem with the fact that even if there's a policy, it doesn't always translate to any actual ability for folk to get what they need. So by that, I mean, for example, we've had a doula reimbursement policy in the state of Florida since 2019. Just can't find a doula who can actually get their claim paid. But the policy's done, written, checked off. It's on the website. Everybody's having a nice time, except for we can't get the services to the family. I wonder what is so hard about us being able to have universal health care, whether it's Medicaid or Medicare or whatever it's going to need to be, that all the states have to, by law, by policy, have that available, because the human right of women's health, pregnancy, birth, abortion, everything, that human right is being denied. And again, I keep going back to this in plain sight. Like, we are all going to join in, because we don't have any option, obviously, with this is okay, even though we know it's not okay. It's the struggle for me. It's just, how do you live with that day to day and ongoingly and keep fighting and not making any progress? And so Medicaid for all, or universal health care, or whatever you want to call it, and the momnibus, those are my two.
It's so hard for me because every time I hear something on the news, it's always that we have to give something up just to be who we are, just to be our authentic selves. And I just want people to stop making decisions about my body, who aren't in our communities, who don't know what it's like, those don't even know the history. Because in this country, and I'm just talking about black women at this moment, but as other women of color have they had never had ownership of their bodies. So you're just changing the way that they're doing it. And I just really want that to stop. And I don't know, it's like you said, it's in plain sight. And I'm like, that sounds ridiculous what they're saying. But I don't see anyone doing anything. Everyone is just like, they vote on it, it goes through. And I'm like, how did that go through? Are you in the same country that I'm in? Do you see what's happening right now? Do you look at the maternal mortality rates? And even, I just have to also just say this, like you were talking about Hawaii, how midwives in Hawaii are not going to be able to practice if they're not CPMs. But the latest statistics and this is just from 17 to 19, they surpassed black women in maternal mortality. And nobody's talking about that. So they keep making these laws, but not looking at the harm that's already being caused. So what does it take to happen? Who has to die for people to say, let's do something about this.
I mean, look at what happened in Nashville. We say, who has to die? These kids died. The kids went to the Capitol to speak out, and they still, in their face, passed the law for open carry. I mean,
yeah. And at some point, I mean, firing legislatures is going to have to be a thing that we as citizens do, because I'm about to, well, anyway, that's a whole other conversation.
I want to do a citizen's arrest.
Yeah, I mean,
I just want to walk up in there and just put their hands behind
like
the
at
back.
some point we need civil disobedience in healthcare, and our professional organizations should be leading that.
Yes. Say that
Right?
one more time.
I mean, we need some civil disobedience in healthcare, and our professional organizations could be leading that, should be leading that. I also want to make another point, though, to your point, Dr. Grayson, about the state legislatures, right? North Carolina finally expanded Medicaid under the Patient Protection and Affordable Care Act. So now there's only 9 states that didn't do that.
Tennessee is one of them.
Right, but it's one of those situations. It took 20 years of a whole lot of people, 20 years working on making a rational case that we should have insurance coverage for the citizens of our state, because we already know that that's an intervention that improves health outcomes. We still, in 2023, have states that have not taken the expansion money to cover their citizens. Clearly, somebody needs to be fired.
Yeah. And, you mentioned professional organizations, and we have to acknowledge that there are power in these organizations, and these organizations were built also in a structure of white supremacy. When the American Medical Association formed in 1847, one of the first things they started to do was go after midwives. And it's not, besides the fact that at that point in time, the workforce of midwives was hundreds of thousands of people, 90% of whom would have been black. Another 9% or so would have been ethnic immigrants, Jewish women, Russian women, parteras in the Southwest, in what is, by the way, Mexico, and indigenous healers who functioned within their communities, and they did that to eliminate competition, to control and pathologize. But so we have professional organizations now that, are talking a good job on lip service about DEIB. I cringe. I get a hives every time I say that, those acronyms, but that's not what they want. They want to do, the surface work. They want to paint on it, but you can't have an American Medical Association whose job has been to marginalize a workforce of women for 180 years and expect them suddenly to start playing fair. No, now they talk about scope creep. You can't expect the American Nurses Association that doesn't like to talk about the fact that it is, really until a year or so before I was born, and in the lifetime of many of the people here, that the majority of nursing schools were segregated. Even as a nurse midwife, I know I catch flack, and I am the official angry black midwife of the American College of Nurse Midwives, and that's fine. But, when we've had other than police, and I'm a historian, that was my first discipline, and I've waited for many years for somebody to prove something to me. Other than the police force, which rose out of slave patrols, there is no other profession that I know of in the United States that was formed around the concept of corralling a workforce of 100,000 black women, eliminating most of them, regulating the rest of them, and then slowly replacing them. And that's what the nurse midwifery profession is. So we have to own that. In 1923, there were 100,000 midwives, and 90,000 of them were black. And, the maternal mortality gap was 2 to 1. That was called penicillin. What a wonderful thing. But now we live in 2023, and there may be about 15,000 midwives in the United States. We attend only 10% of the births, and most of us that do that work function as baby catchers, where we're running from room to room in hospitals, working under the supervision of physicians. How can we have a profession whose job was to go along and get along with the patriarch and now expect us to suddenly be the solution if we're not really willing to undress and strip bare and be vulnerable and say, we can't fix this by just saying racism makes me sad or Black Lives Matter or different projects. We have to be willing to look at it. I think about it every day. I'm a nurse midwife because my grandmother told me to go to nursing school. I was happy to have been a community-based midwife, but she was intentional about me doing the thing that she couldn't do. As a Black woman in Virginia in the 1930s, she couldn't have gone to nursing school if she wanted to. So I'm not here to, make other midwives who, identify by this thing that we call race as white. I'm not here to make them feel better. I'm not here to make OBGYNs feel better. I'm here to save and serve and center Black women, Black families, Black birthing people. And in those regards, if those organizations can't come along for the ride, then sometimes it's time to turn internally and say we don't need them. They either have to make changes, like retrofitting, as Dr. McLemore says, retrofitting isn't working. So we have to reimagine organizations. And by the way, please support the National Black Midwife Alliance. If you're a midwife, join it. If you're not a midwife, join it as a co-conspirator. And I want to give a big shout out to the Black Mamas Matter Alliance, because they really started this work from Atlanta, Georgia, where that has one of the highest maternal and infant mortality rates in the country right now, as an outreach of Sister Song and the work that Black and Indigenous women have been doing in this country for 50 years to bring change, because change really isn't going to come from inside. What is that old expression? Power concedes nothing without a demand. They're going to give you just enough. It's like medical students know that. He's like, we're going to go on strike. We're going to do this. We're going to send strongly worded letters. And they're like, okay, we'll cut the prices of all the food in the cafeteria by 10 cents. They're going to give you something to make you feel happy, but it's always a bait and switch.
Yeah. I really appreciate that. So my last question is one about, what are you hopeful about for 2023? And, we're going to try and do this in like a sentence or less, but to check out basically, what are you hopeful about, and what, as a disruptor, what you got on the horizon? And even if it's continuing the important work you're already doing, that's disruptive. You can say
I guess what I'm hopeful about is, in our clinic, 2022 was a hard year for us. We opened our comprehensive reproductive health care clinic, where we did abortion and birth in the same space. One of the few places that would do it outside of a hospital. I think that for us, 2022 was hard, losing Roe, but also we were hopeful. We opened a new clinic. We opened a new clinic in Carbondale, Illinois, which is about 3 hours from our present clinic, to make sure the people that we were caring for still had opportunities to get the health care that they need. What am I hopeful for? We started a Black Midwifery Fellowship program, training Black midwives to be comprehensive reproductive health care clinicians, because we do more than catch babies, right? I think that I'm hopeful this will be my 6th year being a midwife, my 6th year at Choices. I'm hopeful to continue to disrupt this broken healthcare system. You talk about retrofitting, and I think that's really optimistic. I'm not optimistic about that. At this point, my mom may be watching, so I'm not going to use that word, but forget the hospital system at this point. We have, forget them, right? So we have created a alternative system, and reimagined how healthcare should be. And we are growing our own and taking care of our own. And, I was one Black midwife who went to an abortion clinic and started a practice. We have 6.5 Black midwives in our practice now. We will hire 2 more at the end of the year. We are growing our own, and they're coming from our community. And they are our patients who have received care from us and know how they should be treated, and in turn want to go back into the community and do the same type of care. So I'm hopeful for what I see on the horizon in terms of from our fellows and from our students and from the next step that Choices is taking, and I'm not ready to talk about yet, but I'm hopeful about what we have in the works and what we have for the future. And I'm not really paying attention to the system that continues to disregard us. You know, I'm over them. Forget them. Forget.
See what you did there.
Forget them, right? You know, because in the beginning I really did. You know, I was optimistic that we could change the healthcare system, especially the hospital system. And after being there, I never have to go back there again. Never.
And that's real. That's real. Dr. Drew, in 60 seconds or less.
Yeah, okay.
Like I'm a shush to you.
No, well, I'm hopeful for millennials and Gen Z. Y'all, woo, child. I mean, it took me a long time to get to only having like 2, you know what's left to give. Y'all were born with none. And you have no chill.
They special, man. They special.
You have no chill. I mean, I have been, an outsider all my healthcare career, and people probably thought I was crazy. I've had people ask me if I'm on the spectrum, probably. But I also think that, even though we know race isn't genetic, I do believe that all Black women have this one common gene that actually makes us incapable of caring about your feelings. So, I've been doing this for a long time. Because I've always had one thing, I always had financial safety. I tell people all the time, I say the things you can't say, and you're welcome, because you need to get that bread. But I'm really thankful that y'all are coming, and you have fire in you, and you are not going to take anything for granted, because I'm like, just burn it all down. And let the phoenix rise out of the ashes, and you're the generation that's going to build something beautiful out of a mess.
Yep, I agree. I'm really hopeful because I see we're picking up momentum. This is a movement. We say at Common Sense Childbirth, we're building a movement to birth a more just and loving world. And this is how we get it done. And I'm very hopeful that the work and the groundwork that we're laying now, I'm about operationalizing the infrastructure. I'm about building out a perinatal ecosystem that is safe, that is quality, that is ethical, that is accessible. And that I know, as I see conferences like this, groups like, that are forming, people that are in movements and on the ground, I see us all on the same trajectory. We are going to make a change. We will prevail. So I'm hopeful for that.
Awesome.
And I'm hopeful in that if someone wants to become a nurse, they can become a nurse without barriers. If they want to become a midwife, they can become that without barriers. I just see the workforce getting more and more diverse. And I just want people to know that there's support out there. Find your community so that we can support each other, so that because we need to be here. We have a right to be here. And what gives me hope, too, is that there are people who are coming out of the woodworks who don't want anything. They just like, tell me what I can do to help. And they give money and they go away, and I love it because I don't like when you give money and there's strings attached. So to have people come out and say, here, just give women what they need, we just have to continue to keep doing that. But I think also what gives me hope is that I'm able now to say what I feel like needs to be said. I'm able to do. I know the structures are there, but I don't care. And I do it because I have support, and I do have my community. So that gives me hope.
Awesome. Well, I have to say, this has been such an incredible discussion, and I think we have time for 1 or 2 questions. I want to, really say that if you're not following these individuals, either on social media or newsletters or at the institutions that they've built, Ubuntu, and when you think about Choices, both in Carbondale and in Memphis, when you think about Common Sense Childbirth and having the only accredited community-based midwifery school in the country, how we didn't say that is a real problem. So I probably should have fixed that. So, and I've been lucky enough to partner with you in our work, knowing that there's an unmet need of people who want to be disruptors and midwives. So, if there are there questions online, or we just want to take some of it, or somebody going to tell me what I need to do? Okay. All right. I'm challenged. Monica's challenged.
We can take some questions from the audience.
Up at the right.
Yeah.
Sorry. Hello, I feel like I'm talking to celebrities, y'all. I'm like, my hands are shaking. Sorry. So my biggest question is, I come from a community health background as well. And I really would love to learn more about how can we incorporate FQHCs into these discussions? Because long story short, community health centers are, really helping a lot of marginalized people. One of the clinics I used to work at, we used to have patients literally come in from other countries because of the comprehensive care they will receive. But when we're talking about maternal health, I feel like a lot of clinics aren't getting as much, or a lot of community health clinics aren't getting as much support as they would for like primary care or the other services that they offer. So my question is, how can we incorporate FQHCs into these discussions? Thank you.
First of all, FQHCs provide a vital role in getting help in marginalized communities. I think one thing is to make sure that your board involves community members. And let the community tell you what they want and need, and also be committed to doing the work of anti-racism, which is really radical. Okay, it's not just enough to say I'm going to stop doing the harm that we did, but we're really going to center the needs of the communities, and we're going to radically change everything from what does your workforce look like compared to the community, and what policies and procedures make it ineffective. My Ubuntu is right down the street from two FQHCs.
Federally qualified health centers.
Yes. And there's just some that they can do. I'm a unicorn. I'm a Black doctorally prepared nurse with a public health training background who, performs abortions in a clinic in a church building. FQHCs can't do all of those things, but it starts really with centering and making sure that the members of the community are what drive the services, and not the federal dollars that you can get. And then we're gonna retrofit to make it look like what we want it to look like, and not yet give the community what they want.
And happy Black Maternal Health Awareness Week that we know that starts, April 11th through the 18th. Shout out, and this is, sort of one of the kickoff events to the activities, that happen. I know people are having local and regional events. We are hosting the Black Maternal Caucus next week, so keep your eye on BMMA, Black Mamas Matter Alliance website, because Senator Cory Booker and Rep. Alma Adams and Rep. Lauren Underwood are going to be talking about this very thing, because there's new money that's supposed to be in the Momnibus for the federally qualified health centers to build out the workforce and the community engagement component. But again, it's still languishing in what is our dysfunctional Congress. Yeah, there was one over here.
And while she's going to that question, just to go back to the clinics, is they really have to, like what Dr. Drew said, they have to connect with the communities, because they get the money, they think they know what the community needs, and they go out and the community has more problems than when they went in.
Yeah.
So they really have to take the time to learn the needs and talk to people who are living day to day in these communities.
Also, all of the federally qualified health centers in our community are religious based. Yeah. So, it can be very problematic and very hard to navigate that as well. We have Christ Community, FQHC, and Church Health and Resurrection. So it can be really, really hard for them to navigate that as well.
Hi, thank you all for talking today. It's been very inspiring. My name is Imani Barnes. I'm an undergrad student at the University of North Carolina at Chapel Hill. As of last week, I just got accepted into nursing school, and I'm very excited for that journey. And I think in the past year, I've become very, very passionate about the topic of Black maternal health and just exploring everything around it and researching it. I just want your advice on continuing to find my voice in health advocacy and growing that voice throughout this journey, throughout nursing school and beyond, even if it feels like I'm the only one in the room or the only one in the school that's really fighting for us. So I just want your advice, and thank you all again.
Awesome. Well, congratulations on being, admitted to nursing school. And I can tell you, you're going to have to go across the street. So as the person who gave the UNC Chapel Hill Columbia Street lecture, Columbia Street is the street between the schools of medicine, nursing, and public health, because there are a lot of allies and reproductive justice informed individuals who are across the street in the School of Public Health, not on the same side where the School of Nursing and the School of Medicine is, in terms of wanting to really find community around, the kinds of Black maternal health things you are probably interested in wanting to study, right? Not just death and dying, but justice and joy. That's why joy is being centered next week in Black maternal health. So you're going to want to have to cross the street to make sure that you're supplementing your nursing education with the people in the School of Public Health who are a little bit more progressive.
And congratulations. By the way, you are stunning.
You are cute.
I just need to say that. I'm like, who is this girl? I know I love us, but baby girl, you are just beautiful inside and out. Somebody find her Venmo and send her some money, because nursing school is expensive too.
Nursing school is expensive.
I just really want to encourage you while you're in school to connect with the National Black Nurses Association so that you can be involved with students, not just in your local area, but, around the country. You'll find community, you'll find people, and never forget your family, your extended family, because they are rooting for you. They love you. They know that you have the ability to do this, and they're going to hold you. They're going to hold you up. You're standing on the shoulders of not just your mom and daddy, but your ancestors. There have been people looking down on you and proud of you, all your life. Don't forget, to remain that person, because when you lose your center, that's when it's easy to get confused and stressed and strayed and broken.
Yeah, that's what I was going to say. Find community. We're out here. Reach out. Don't be afraid. I think that's, I say that at every talk, and then I have all these kids in my DMs. So, my assistant absolutely hates it because I talk to every one of them too. I think it's really important to know that you do have support, and that we are all rooting for you, and that you are not alone. Right. I think that's the biggest thing. And if your goal is to go on to, like midwifery or something like that, there is community here, and definitely, seek out spaces where you can learn, that are going to be safe for you. Yeah.
Yes, and I would just like to add to that, definitely find your community, but also trust your experiences have value. Nursing curriculums often don't talk about people of color. Things are just one way. Challenge those things. Every class, don't tell them I told you this. But
You can say I did.
Every class
say I did too.
Every class challenge them, because sometimes you may be taught by someone who doesn't know anything else, and because they have so much pride, they don't want to admit that. But I have to say, most of what I learned was from students. They opened my eyes up to perspectives I didn't even think about. So
I would give my professor readings and reading lists.
I love
should be the reading list for this class. Yes. I looked at your syllabus, and it was insufficient.
Trash. Well, as I usually do in the presence of Black midwives, I'm going to give them a standing ovation for their incredibleness. Will you join me?